Tell me real quick what's going on. Just talk to me about what's wrong with the jaw, if anything, or your teeth or your bite.
My bites off, and every once in a while I get a cramp under my chin. And they say I grind my teeth at night, or grind my teeth.
Did they ever make you a splint?
Yes.
Did it help?
Didn't seem to.
Did they ever give you medication like muscle relaxants or anything like that?
No.
Nothing? Okay. Let me tell you something. A lot of times when the bite's off like this, it'll make the teeth hypersensitive, and believe it or not, after I adjust the bite, it usually goes away.
Good.
Good. Keep it in. And now look at the lowers. Okay, Gene, tilt your head back for a minute. Thank you. Right there. Air. Got it? Perfect. Bite home hard. Go to the right. Open big. You did it. This is chewing. This is bite. And this stuff all over here is muscle. Now watch as you start chewing to the right. What should happen, see, this is like a trail of breadcrumbs where you work.
Mm-hmm.
This is the center of force. It's the sum addition of all the force that's happening in a given moment. And right now, the average of everything is right there, which is to your right, to the back. What should be happening is it should be shooting up towards number 6, which is your canine. But it's not. Instead, it's shooting towards some of these back teeth.
We're almost done with them.
See, like, look at that percentage. It's not supposed to happen. If you'll remember that video I showed you last time, I talked about how canines are supposed to separate back teeth.
Yeah.
Your canines have lost their function. So as a result, they're rubbing on the back, and that increases muscle activity and all this kind of craziness that shouldn't be happening that way. It shouldn't hurt. If it does, let me know and I'll stop, okay?
Yeah, I know what you're talking about. I used to get that. It happened every once in a while, and I'm like, what the?
Yeah.
And I had this done, and I haven't had that happen since then.
Okay. And separate votes.
Both alloy.
PFN version 29 to 31.
It's in there, the only thing that's not is the 30.
Okay, turn to me if you would. Feel too thick or not bad?
No, it feels better.
See, now you're tracing up towards the canine like you're supposed to be, but you still got deflections along the way. All that needs to go. Bite home hard. 1, 2, go left and open. Good. You're not getting separation when you go this direction.
Well, that
So I'm going to create it. You've got a cross bite. Yes. I'm going to create it on a tooth that it normally isn't on. Might pinch a little. See, we're creating a canine rise of sorts on a premolar, which is unusual.
How come on the premolar?
Because this canine's crossbite, it's end to end, so we've got to put the force. That's why this is unusual.
I remember you saying something about in this exam.
Yeah. I don't do it very often, and I'd rather not because the premolar root's not as strong, but it works. I mean, it should be the one in front of it, but you need braces to push this thing out. And I'm trying to do it so you don't have to get braces, you know what I mean?
Mm-hmm.
There you go. Come left. Okay. So tell me how it's been.
It's been great.
What was it like before we worked on it?
Well, I'd had the cramps underneath my jaw,
Yeah.
and my bite was really uneven, and it's been just fantastic since then. So.
And it's been what, about 5 months? 4 months?
About 5-6 months.
Yeah.
Yeah.
How long did it take you to get used to it?
It was less than a week. The first few days, I had to really control how I closed, would bite down and everything. But
Sure.
Then, before I knew it, it was just like
Natural.
It's so much easier now. So.
Excellent. Is it easy? It's easy to chew?
Oh yeah,
More efficient?
exactly.
Cool. Thank you very much.
You're welcome.